In the year 2000, I came to a crossroad. I had to decide, was I going to continue to develop this machine or stay in practice? Because in the year 2000 to about 2003 was costing me a fortune to engineer and develop prototypes and test this thing while I'm still in practice. I spoke to my wife and my kids, and I said, either I drop the project, go back just into practice, or we liquidate everything, sell the practices, sell the building, sell the house, relocate to Florida, where at the time it was a little more affordable. And they agreed to follow my dream.
Hello and welcome to Along the Way Life's Journey. I'm your host, Carl Buccellato. There are many people in this world who suffer from chronic pain, trouble just getting out of bed in the morning, or having become addicted to prescription drugs that their doctors have prescribed. That's no way to live. Today our guest is Dr. David Bass, who has a better way to treat and overcome such pains. A skilled chiropractor, therapist, acupuncturist, and medical inventor specializing in spine pain management. Please welcome Dr. David Bass, my doctor and my friend. Dr. Bass.
Thank you very much.
Dr. Bass, thank you so much for being on our show.
It's my privilege to be on your show.
Well, you are quite a guy. I've known you for a little over a year now, and you took me from a hunched over guy who had difficulty walking easily, and I haven't had pain in my back in a long time, thanks to you. And a lot of it is due to your special tender care, but much of it is done to your special inventions as well. Before we get into that Antalgic-Trak that you invented, we're going to talk a little bit about who you are. You've been a practitioner for more than 25 years. You were in practice in the Northeast for quite some time as one of the most successful single practitioners with over 20 locations. And I say single practitioners, but you had acupuncturists and you had masseuse and you had medical doctors in practice with you in all of those locations. And you really took the entire science to a new level. I can remember when people first told me about chiropractic, I envisioned going into this little dark room on a massage table and people breaking my neck in different directions, but you have taken it to an entirely different level. Tell us a little bit about David Bass and how you came to be a specialist in what you do.
Well, I started in the field of chiropractic. I started my Northeast practice in 1980. It grew to one of the largest single clinics in chiropractic on Long Island and part of the Northeast. We used to treat between, I would say, 300 and 350 patients per week. And we did that for many years. And at some point, we started to create the integrated model where we would place medical physicians, PTs, into chiropractic clinics to improve their level of service and to improve what kind of services they could deliver. And that is how we started to expand the integrated practice from the end of Long Island and East Hampton all the way up to upstate New York with those 20 or 24 clinics that we had. And it was growing very smoothly. And what was happening is now that the chiropractors were working with medical physicians, the medical physicians would put their input into the chiropractic practice, and we would combine the services of medical and chiropractic and wind up with a better patient outcome. And we did that for many years. We got to a point where I started to develop an interest in medical equipment. I had a particular patient who came into the office one day with a severe neck injury, severe neck pain and arm pain, where this patient couldn't even sit still. They would just rock themselves in pain, hoping for me to do something. So typically we want to unpinch that nerve by laying them on a table and stretching the bones apart, the vertebrae, to create a larger space for the nerve. That relieves the pain. But every time I tried to put this patient down on the old-fashioned flat table, the pain was just too great. So I tried an experiment. I took off the harness section of this flat table and I picked it up while the patient was in a seated position. I held it over his head. I put the harness on his head, sitting up, and I told him, and I'll lay you down. As soon as I lay it down, I'll turn the machine on and it will start the decompression or the traction. That's what I did. I put him down. I turned the machine on. It starts to pull. He couldn't tolerate it. And I didn't know what to really do. So I grabbed the top of this harness apparatus and I turned it. And while I turned it and it was pulling, his pain reduced significantly. And it just struck a chord with me that the postural position of therapy is just as important as the therapy. So
Right.
now I started to create the Antalgic-Trak, which allows me to posture position in 10 different directions a person's cervical or neck spine or their lower back spine. And this innovation allowed us to better target the spinal discs, the spinal nerves, and to create a improved level of therapy with an improved outcome. And once we proved this theory, there was really no stopping us. We began to manufacture these tables starting in 2006. So, but let me go backwards, because in the year 2000, I came to a crossroad. I had to decide, was I going to continue to develop this machine or stay in practice? Because in the year 2000 to about 2003 was costing me a fortune to engineer and develop prototypes and test
Sure.
this thing while I'm still in practice. And I decided, I spoke to my wife and my kids, and I said, either I drop the project, go back just into practice, or we liquidate everything, sell the practices, sell the building, sell the house, relocate to Florida, where at the time it was a little more affordable. And they agreed to follow my dream.
Wow.
So yeah, so
Wonderful.
in 2004, we moved to Florida, and I found a new engineer. I partnered up with a colleague of mine, Dr. Scott Denny, and together we continued the project. In 2005, I secured an FDA clearance, and in 2006, we were selling these machines and selling them even before they were built. And that was fantastic till about 2008, when the real estate crisis
Yeah.
stopped the
Fell
economy.
out of bed, right?
I don't know what happened, but the phone stopped ringing. Doctors couldn't get bank loans. Banks weren't giving money. And I didn't really know what to do. And we started to get calls from outside the country. We started to get calls from Turkey, from Greece, from Korea, from Kuwait, of all places, interest in the table. And we started to develop sales outside the country. And that kept us alive. And then in 2009, I thought, maybe it would be a good idea if I opened up a clinic with the machine where doctors could see it treating actual patients. And I can train them now in the clinic instead of in the factory, which was in Weston at the time, Weston, Florida. And so I secured a location. I opened up the practice. I put a few ads out into the community. And in about 3.5 to 4 months, I found myself back in full-time practice because patients wanted this therapy. And so I couldn't really ignore the income stream from it. So I had the practice going, and I had the manufacturing and the sales of the Antalgic-Trak simultaneously. And then in 2013, my Korean sales rep wanted to have a special meeting with me, and he came to the United States, and I thought he wanted to give up the line. But actually, he brought an engineer with him, and he wanted to manufacture the machine. And just the way he described the process, we decided to pull our manufacturing from Western Florida and move it to South Korea, where they've improved the fit and finish, the delivery times, the quality of the machine. Everything is much better. And so we just continued on like that. And then we've developed sales across the United States, Canada, Mexico, the Caribbean. We're in the UK, France, Spain, Germany, Turkey, Moscow, which happens to be one of my largest customers, Kuwait, which is one of our largest customers, Abu Dhabi and Dubai, Azerbaijan, which I actually had never heard of.
Yeah.
Seems to be north of
So
Turkey.
wonder you can even pronounce it.
And so we've been doing both at the same time, the practice and the manufacturing and selling of the Antalgic-Trak.
I can tell you, as an individual, I had chronic pain from 1996, and many, many people attempted to help me with my chronic pain. I even became addicted to prescription drug as a result of it. And that's all way behind me. But it wasn't until I joined a new church in my community, and everybody in the church, half the people in the church said to me, "You got a problem with your back, gotta go see Dr. Dave, gotta go see Dr. Dave." I said, "Who's Dr. Dave?" And ironically, the Neck and Back Pain Institute, which Dr. David Bass created and operates, is 5 minutes from my home, and I didn't even know it was there. And so I went there with a little trepidation, because I've heard many people tell me they could help me over the years. And then I looked at this machine that looked to me like Star Wars, this big chair. And I said, okay, I've jumped out of airplanes, I can jump into a chair. So I went into the chair, and they adjusted all these different things. And he's got a tremendously trained staff, excellent staff, which is all due to his head leadership, But they strapped me in this chair, and it felt like everything was moving. And I did this 2 or 3 times a week for the first few weeks, and then a couple of times a week, and then once a month or something. And now it's been well over a year since I've there. I have no pain in my back whatsoever. I have a little problem with my hip because of arthritis, but that's nothing to do with the back situation. And that's all they credit to this man and the creation of this state-of-the-art piece of equipment that is specifically designed for spine and neck stress issues, to decompress them. So I'm pitching your thing, but I'm going to let you talk more about it. I just wanted to say there for a moment, let people know it actually works. My goodness, it works so well. And on top of all of that, I want to repeat again, you walked into that office, and it's a very busy office. Patients coming and going all the time. Tons of files in the office that are on display there for people that are being helped and treated. But the staff is excellent. They're greatly skilled, greatly trained, and it all comes from Dr. David downward and his lovely wife, Ronnie, who helps in the office there, runs the office, everything. So I encourage you, if you have a problem, look up Dr. David. You're going to find all this information in the show notes. You'll know just how to reach him. Click on, and he'll be able to help you. Now, you have patented this piece of equipment, and you have hundreds and hundreds of them sold all over the world now at this point. And I'm quite sure that you get lots of happy mail. I can not ugly mail, but happy mail from people that you've helped. Are there any particular stories that stand out in your mind that you'd like to tell people about?
Well, I get more emails from the doctors using the devices, and these emails are typically, they're all happy. And of course, if they don't contact you, they're happy, because if they're not happy, they're going to contact you even more.
Yeah, right.
But I get, most of my emails are basically clinical emails from the doctors. They'll say, I have this 75-year-old woman with osteoporosis and a scoliosis and 3 bad herniated discs. Can I put her on the machine? And of course, I'll go through clinically with the doctor. I'll just mention a few items about the patient's strength level and how we can gently test to see if a patient can tolerate the therapy. It's very rare when they cannot. I find the only patients that have difficulty tolerating the machine is if somebody has a very sensitive stomach or rib cage, because we have to put a belt around the lower rib cage and over the pelvis when we're treating the lower back. And it has to be somewhat snug. But over the years, and we're doing this for many years, I've only had actually 2 patients, both were women, that couldn't tolerate the pressure of the machine. But all the other hundreds of patients who go on the machine, it's like a new pair of shoes. It takes a visit or 2 to just adapt and get used to the feeling, and then you're okay. And we treat probably 60% of the patients are lower back, and maybe 40% are cervical or neck. But what we're treating basically, which is the most important component of most spinal issues that anyone generates, is due to the forces of gravity and the micro traumas of gravity, lifting, pushing, pulling. I have a model of 2 vertebrae, and if somebody is lifting too much or they're bending them properly, the disc, which is this red item here, it gets squeezed, it starts to bulge. Yeah. And it could bulge right on the nerve root and create a significant amount of pain. And you can't push it back in. You could only pull them apart. And as you pull them apart, you create a vacuum that retracts this disc back into its pocket to allow it to begin healing. So we repeat the treatment and repeat it over a period of several weeks, because you'll need to keep it retracted as the cartilage is trying to heal.
So I imagine
which is great.
I imagine this has been recognized and written up in medical journals all over the world, because this is a rather innovative approach to things that have been a problem with mankind forever. And look at me, folks, I know what I'm about to say. Part of it has to do with obesity, with getting out of shape. But
let me say one thing about that. Let me say one thing about obesity and thinness. I find the patients who are very thin are the ones who are generally developing osteoporosis. Mm-hmm. They don't have enough weight on their body to stimulate the electrical charges that bones get when you walk. Yeah. There's a charge that goes through your body that tells the body to absorb calcium into the bone. So the bigger and heavier somebody is, the more electrical charges are stimulated, the stronger the bone gets. And some people who are at their normal weight or too light, too skinny, those are the ones who usually develop the osteoporosis. But they can still tolerate the treatment because we're unloading the spine.
Right.
Whereas this person tries to lift something, they can get a compression fracture, which is not a good thing.
Not a good thing. So Dr. Bass now lives in Florida, along with his lovely wife and his 3 daughters and his grandchildren. And he's a very happy guy, because when I see him, he's always smiling. So he's got a wonderful family life in addition to wonderful practice.
Thank you.
Your kids must be a great joy to you, I'm sure.
Oh, they're great. And it's nice to have them close by.
Yeah.
I've got my oldest and middle one are here with each having two granddaughters. So that's 4 granddaughters there. My youngest, who'll be moving to Florida now within the next, I'd say, 10 months. She's pregnant with her first, my 5th granddaughter. So we've got a lot of estrogen running around.
Yes, I see.
And I'm used to it. It's good for me.
Well, it's good. It's good for the nation. Trump is saying we have to have more babies. So, that means you need a lot of women with estrogen out there. We have to develop more babies.
We got them.
So
yes, I know.
So if you were to advise people to things that are being offered to people, I mean, I'm not going to ask you to be contradictory to what other people offer, but I'm sure you have some opinions about some of these pills and these creams and all of these programs that people tell you to do that seem to be nothing more than a cash register for the pharmaceutical industry. That I'm sure the natural way that you approach things has a different opinion than all those things.
Well, yes. We've had patients who come in here. Many of the patients come in here as a more of a last resort. Some patients come in as their first resort because they do their research. They could find us on the internet. But many patients have been to maybe other chiropractic offices. They all go to their family physician, their main physician. Some go to the orthopedist. Some have had surgeries, partially effective. Some have had surgeries that are terrible. And I don't see the patients who had successful surgery, so I don't
Right.
know how many there are. But the one thing we find is a lot of patients are having the epidural injections,
Yeah.
which I'm not entirely opposed to. So they come in here and they kind of put a needle through here into the canal
Yeah.
and put a steroid in, which will dramatically reduce the inflammation, which makes the patient feel much better. However, they still have the compression.
Right.
So the steroid can't really get into some of the wounded part of the disc where the cracks are. So I often tell patients, if you're having an epidural on Monday, come into our office on Tuesday. We'll put you on the machine, distract the area of complaint so that the vacuum that's created from the decompression will draw the steroid into the disc cracks to enhance the outcome. And the patients, they can really feel the difference, especially those who've had an epidural and not seen me. And then they see me after the first epidural because it didn't work so good. And then they're thinking the ortho says they should have 3 epidurals. So I said, well, after you have the second one, come in, we'll put you on the machine. And it does make a big difference. So I'm not opposed to the epidurals, but I think the epidurals do better when you have the distraction or the decompression because it opens the joint and it pulls the solution into the compressed areas that need it.
It just seems to be so logical that when you decompress, so many more things can happen. You know, when you get that pressure off the spine and decompress to allow that vacuum effect to take place, it just seems a logical thing as you're explaining.
Well, so a patient comes in and they have the disc problem. They go in and they're having a consultation with the orthopedist, and the orthopedic surgeon wants to go in there and do a discectomy, cut this piece out, which can really give a lot of relief, except they're still compressed.
Yeah.
So they did a large study in Korea, South Korea, where every patient who was suggested the surgery, they put them on the Antalgic-Trak first. And they found that the outcomes for those patients who had the epidurals or the surgeries after the decompression, they did better because we removed the compression that created their problem to begin with. So some people are having discectomies and then they leave, but they're still compressed. So it's not long after that they start to have some newer symptoms from the same disc or the next disc. So you have to remove the compressions before the spine could experience its pure health.
Well, that explains a lot to me because being my doctor, for a long period of time from 1996 forward, I had tremendous chronic pain and they kept taking me into the pain care center. And over the period of years, 37 times they did epidurals or neuroplasties into my back. And they tell me that they were going to last this long. They never lasted more than a couple of weeks. Never. And there was a point in time there that they inserted a morphine pump into my spine so I could self-regulate because of the chronic pain. And I would walk with 2 canes. And that is a history now. It's no longer my life. It's no longer my life. So, I applaud you for what you're doing. I really think you're doing wonderful work for people. And you're a man with great empathy for people. I know that, Dave. When I can tell when you give me the treatment and you rotate my back and my spine and you do all that stuff, you're always making sure that I'm not hurting too much. And I like that a lot. I think you're a regular guy. You really are a regular guy. And
Appreciate that.
I'm very, very happy and honored to know you as a doctor and as a friend. I must say, you're a wonderful man.
And likewise.
Thank you. Thank you so much. Anything, we're going to be showing a lot of videos and that you submitted to us and pictures of the Institute and the various equipment. So the time shooting will be a little shorter than it will normally be. Anything you'd like to tell people before we close down? Any specific advice or suggestions you have for anyone? Even as much as, come on down, I'll take care of you, whatever it is.
Well, we do offer, we never charge for consultations. And I have patients coming in, they're not even patients yet. And some become patients, but some don't. And I'm happy to read their MRIs and go over their information with them to give them an idea of what we do. And then, of course, they'll choose what they want to do. But we have an open door for patients. We work with the patients to try to give them the best outcome they can. And as I said before, the study that was done in South Korea was done at, I forget the name of the Korean hospital. It might maybe the Kim Hospital. I don't remember the name, but it's a 500 patient study of patients who they put on the Antalgic-Trak and how it improved the outcomes of all these patients, whether they had injections or surgeries or massive PTs. Anyone who had the Antalgic-Trak along with it did better than the control group without it. So this is information that it's been difficult to get out to the world, and I appreciate you helping me to do something like that, because we're helping people,
right?
And
exactly.
There's people out there that don't even know this therapy exists, and they could be helped dramatically. And if it doesn't help them as much as they would like, they're no worse off. It's you do no harm.
Right.
So it's always worth a great effort to try this therapy, because the majority of people do well with it.
Well, I can't speak highly enough about it. I can only say to you that all the people I know in the church that I go to have told me, as I said earlier, to go see Dr. David, because it's helped them as well. So many people who have had different problems that have gone to you for treatment. And it's like the alumni of the church are all your patients in there. I walk in there so many times and I see people in different chairs that I know from Sunday. And it's a blessing. It's because it works. It works.
Really appreciate it.
You're a great member. You're a great asset to this community, and you're a true healer. There's no doubt about it. You're a true healer. So, ladies and gentlemen, you know my story. You know who I am. I'm a man who wears his beliefs on his sleeve, and I say it all the time. I talk about my faith in God, and I know that there is a great blessing that comes from being the type of person who has an empathy for others, who does outreach to help others in their life, whether it's assisting them in trauma with their homes or personal problems that they have, or physically, like Dr. David has done. He has taken it upon himself to create something that is good for mankind. And so I encourage you, if you need to know more, click on the show notes, go down and see him. If you have a friend or a family member that's suffering, by all means, go see Dr. David, because I think the man is fantastic. I can't say enough about him. It's just wonderful. And some night he'll buy me a drink to say thank you for this. That's the way to do this. So,
that's a deal.
It's a deal. I know that. So this is my story. I remind you, you all have your own story. Everybody's got a story to tell. Tell your story before it's too late. Tell it to the people you love. Tell it to your friends. Tell it to the newspaper. Share that wisdom, because when it's too late, it's too late. And the world will lose all that wisdom. We need it desperately. Share your wisdom with other people. And I'll tell you what I tell you all the time. What do I know of this big blustery guy from Brooklyn? I don't know much of anything, but I know one thing to be true. Get somebody you know today, grab them in a big bear hug. Tell them you love them. Tell them you love them. It may be the only time they hear those words. And I'm quite sure God loves them also. And he loves me, and he loves David, and he loves you. So share the word with others. David, you know what I'm going to do now, right? I love you, brother. I love you.
I love you too.
God bless. Ladies and gentlemen, that's our show for the day. Call Dr. David. You'll never be sorry. That's it.
Thank you.